It's up to 3 million people now in the U.S. are diagnosed with epilepsy. There are actually, this figure's up to 200,000 new cases diagnosed in the U.S. every year. 1 in 26 Americans eventually will develop epilepsy, so it affects a lot of people. It's children and the older adults that are the fastest growing segments of the population with new epilepsy cases. And if you count the most common neurologic disorders, you can count them in different ways, but most sources would say the highest numbers are migraine, stroke, Alzheimer's, and then epilepsy. So it's up there. In terms of the comorbidities, there's sort of three categories: somatic, neuro, and psychiatric. Somatic, the fractures, a lot of these meds induce hepatic metabolism. They lower the vitamin D level. A lot of these kids are at risk these patients are at risk for fractures when they fall during a seizure. They already have osteopenia, say, from low vitamin D. That's an example of a somatic comorbidity. Neurologic comorbidity, well, we know if you have autism, you have a much higher chance of having epilepsy, probably something like of 25 to 33%, something like that. It sort of depends. If there's intellectual disability, it's much higher. Of course, the population is aging, so the rate of Alzheimer's is going to skyrocket. It already has. There is a comorbidity there. Other neurologic diseases have a higher chance of ultimately developing epilepsy. Mental health, a big issue. Clearly higher risks of ADHD and learning disabilities, as well as affective disorders and suicidality.